I'm Dianna Reely. I'm 58 years old. I'm living in Bonnie Lake, Washington. And my relationship to Edie Baker is that we are colleagues.
Hi, I'm Edie Baker.
We have had a long journey together. We have so many similarities. So both of us starting our career in health information management about 40 years ago. Who would have thought we'd end up with our careers being in skilled nursing facilities and assisted living? I know for myself, something that I never imagined. So I'm looking forward to the conversation about how we got here. When I think about, the first time that I met you, that goes back, I think, to the early 1990s when we both came to work for Providence at Providence Home Care, Hospice of Seattle, and Providence Home Infusion. I had taken the job as the director of quality. My job included helping Providence set up what we were calling a home services network. The intent was to package home services together and be able to sell them basically to insurance companies as part of health management organizations. I was meeting the team at Providence, and you were the medical records director, manager, leader. And I remember that we weren't there together very long, but I do remember meeting you and how impressed I was about how professional you were and how, you had everything so organized in medical records. And I know you were trying to work through a lot of new systems. If you think about that in the 90s, before we had fully functioning electronic medical records. But I was really intrigued by you. And then you left and we really didn't get the chance to know each other, and then come back around to the year 2010 when I came back to Providence. And there you were. We got the opportunity to work together.
I do really enjoy working with you, Dianna. And I had left Providence Home Care and Hospice of Seattle to move to the Olympia area. And I worked in skilled nursing at Mother Joseph Care Center for many years. I started in 1994 and I worked there through 2007. So during that tenure, though, Dianna, we crossed paths again. I had made a decision to leave home care to go into skilled nursing, but I did some process improvement courses through Providence, and I decided to make a career change in 2007 and moved into operational excellence. And it was in that capacity that our paths crossed again. It was a green belt that you were interviewing for. You sat down with Jennifer King and I. I just remember parts of that interview and thinking, I'm in awe of you. We were both like, oh, Dianna, hands down.
That's kind. Thank you.
You can totally do this. And then our paths kind of came together and congealed even more. I started really supporting the home health or home and community care service line. And in that capacity, we worked together on different process improvement projects. And then over the course of time, our organizational structure changed. Our paths together just became more and more connected. We were colleagues again. We were working with a team, and both of us have a real passion for process improvement. It's how do we make things better? I think that's what brought us back to this skilled nursing. I thought, I'd moved into operational excellence in 2007. I actually struggled with that a lot. I like to be in service of residents. That's really where my passion lies. And so I thought to myself, how do I maintain that? How do I still stay connected to that resident population and be able to serve them in a different capacity? And came to the conclusion that I can still do it. I can still, whether it's in skilled nursing or in home health, hospice, infusion, any of our service lines, really support our senior population. So in OE, I stayed connected to the skilled nursing facilities, did many projects with them. When you came back to me and said, hey, do you want to self-support medical records, skilled nursing facilities across regions? I said, I've got lots of skills and talent I can bring to it.
In my 40-year career, I remember being driven in the 80s. There was a TV show was on about a hospital system called St. Elsewhere. And one of the characters on the show was the hospital administrator or assistant administrator, a female character, and her character name was Joan Hallen. And she was played by the actress Nancy Stafford. I'll never forget that. And I remember watching that show and thinking, I want to work in a hospital or some sort of setting where I'm surrounded with really wonderful, brilliant people, doctors, nurses, etc., that are taking care of people. But I kind of want to walk around in a suit and find ways to make things better without being a nurse or a doctor, because I didn't think that was something that I could do as well as the people that I saw portraying that function could do.
I just can't imagine doing it without you.
Well, me neither. It's a mutual admiration club then, so thank you. Thank you, Edie. It was great to talk to you today. I appreciate it.